Most people at some point have had an aching tooth and ignore the pain. But today we're talking about why it's so important to see a dentist if you think you may have an infection. Dr. Virginia Lee from Capital Oral and Facial Surgery Center joins me now. Good morning.
Good morning, Angela.
You know, I don't understand that. If someone has pain and may have an infection, why do you think people don't go to the dentist?
You know, that's always a good question. You know, I think a big part is most patients are a little afraid of what they might discover, and also just afraid of, you know, what they might have to do as a result of that.
Oh, yeah.
And sometimes it's even a financial issue as well. So they try to put things off as long as possible.
Okay. Now, all right, I can appreciate that. I mean, maybe I've not gone to the doctor as quickly as I should have. But what are some of the symptoms? Let's talk about some of the pain that people might be experiencing that could need attention.
Yeah, you know, that's a good way to start. You know, most infections will start with a small little cavity that eventually may progress to a big cavity, or say a tooth breaks off. And what can eventually happen is that they may notice a little bit of swelling of the gums or a little bit of sensitivity to hot and cold. And then eventually that sensitivity becomes spontaneous pain, where it wakes them up in the middle of the night. When that happens, then that infection is getting bigger and bigger.
Oh, goodness.
Oh, yeah.
Well, you know, one thing I've noticed, you know, if ever I've had a toothache, you think, okay, I'm just going to maybe pop a Tylenol or something and it'll go away. It never goes away.
It never goes away.
So, you know, given that some people will wait to go to the dentist, what are some of the things that can happen, say if you don't go, like some of the types of infections that people can get?
You know, first it starts with a little bit of gum swelling. And if your gums get a little bit swollen, that's usually an indication that something is going on where bacteria is starting to grow. Once the infection starts getting bigger and bigger, then it starts eating some of the bone away. So they may have more and more pain that may become a chronic pain. And eventually they may have pain that radiates to their ear, or they may even develop headaches or chronic sinus problems.
Wow. See, now that's interesting. People who have sinus issues, it might be related to your teeth?
Absolutely. And sadly, that's one of the things that most people ignore. They think, oh, it's a sinus, it's because of the weather or hay fever or things like that. And sometimes it can go on for years and years and years. But that really should be evaluated, at least to rule out that there are any dental problems involved.
Oh, yeah. I know you brought some pictures. I took a glimpse at some of them, and they're really graphic. But let's look at some of those, and maybe you can tell me. I know you mentioned earlier that if you get a boil or something on your gum, that's certainly nothing to ignore. Goodness gracious. Do you see that picture?
Yes.
What is going on there?
Well, you know, your mouth is full of bacteria. So if you don't actively remove that bacteria from your mouth, and that's, you know, starts with regular toothbrushing and flossing, eventually you get to the condition like this patient, where their gums get very, very swollen, and eventually that bacteria will stay in there and start eating the bone away.
Wow. And you can avoid something like this just by flossing and brushing regularly?
That's
and
really
going
the
to your
easiest
dentist.
way to start.
Ooh,
That's right.
My goodness, I know we've got lots more pictures, so I guess we might as well just have at it. Now, here's a case where the guy's face is swollen.
That's right. Now, this one started off with a little bit of, once again, a little gum swelling that he put off for several months. And then it progressed, and then one morning he woke up and his face started getting more and more swollen.
Well,
in fact, the one that we are looking at now, obviously he waited a bit longer.
Gracious.
So his eye now is involved. And when you see a condition like this, that has to be treated right away.
Yeah.
That's not something you should wait on.
Now, what's going on here?
Well, this is a swelling on the lower jaw due to abscess teeth in the front.
My goodness.
And it's now all the infection has eroded through the tissue. So now the infection is now not just coming out from your tissue, like your gums, it's now coming out of your chin down here.
Goodness gracious. And here, a boil?
Yes, once again, a little gum swelling due to an abscess tooth. And that can even be from old root canals. Sometimes root canals, even though we think that will take care of the problem, they may not have any symptoms until they start getting some gum swelling.
Yeah.
This is a similar case. Trauma, say from falling down and hitting that front tooth,
Oh, yeah, yeah.
actually caused the nerve to die.
Yeah, because it looks like that tooth is dead.
Yeah, it sure does.
Wow. I mean, this is really graphic, but you know what?
Right.
Maybe sometimes it takes that because it's a very serious thing. If you have a small problem, it doesn't have to turn into something like that.
Absolutely not.
Dr. Lee, thank you so much. We really appreciate you coming. Every time I see you, you give us more great information.
Thank you, Angela.
Thank you for joining us. Hopefully we'll see you very soon. And we'll have more Let's Talk Live coming up right after this.